hand wipe the contact points and then the arm. Don't touch the optics. But we have these receptors covers. So how many days a week or month will you going to be working?
Is he working one day every week at the minute?
Yeah.
So these are receptors covers. They can be autoclaved. Instructions are in.
Autoclaved every day?
No.
Just
you wipe them over in between each use. If he's using it once a week, do it about every 2 months.
Okay, cool.
And then put the spares on.
Okay.
Because obviously you're wiping them anyway.
Yeah.
So good rule of thumb is wipe anything blue on the head, not much else.
Okay.
And then just your top arm. And these will last years. And then if you need any more, because they degrade, get skin support.
And we just ring you and get them?
Yeah.
Yeah.
That's a long way off it. I'd all leave my card and my details, but you'd all have forgotten by then. Because it will be a long time coming. Here you've got a box of 10. They're called vision guards. These are more important than these receptors covers. What they are, they're a plain plastic lens, and then that clips on there. Now, when you're doing that, you splatter and everything, I know. So at the end, pull that out, use one of your normal wipes, and then a dry wipe just to remove the residue, and then you can push that back in.
Wait, so that stays on there all the time?
All the time.
Okay.
And then you only take it off and replace it when visually it's too scratched and it's annoying the user when they're looking through. So at the moment they won't see it's there.
Okay.
But after months they might, and then you've got 9 more.
Okay.
But you'll probably get 6 months out of each one of those.
Okay.
Okay? So now in terms of actual use, like I said, it folds in on itself. So when you're moving it, have one push.
Yeah.
And that turns it on. Here controls the brightness. I just leave it default on full because that's what most people use it on. This is the IPD changer, so that changes the interpupillary distance for each user. Here, if you want to look at these eyepieces, you have 2 options. If you're not a glasses user, you keep these rolled out. If you wear glasses, these have to be rolled in flush because you've already got that gap between the lens and your eye.
Okay.
If you don't want to use glasses but you have a prescription, you can dial your prescription in here if you know it. If you don't, keep it 0 because what will happen is down here is a varioscope and it changes the focal point up and down. So you can run up and down the canals without moving the scope. Using that, you can focus in if your eyesight's bad, but it means when the camera's on the side, that won't be in focus because that sees true.
Okay.
So it's best to have your vision corrected when using it. Here's your mag changer. The lowest is about 4 times, and then it skips up through 5 different rotations, and the highest is about 24. Most people work upon 6 to 1, which is about 6 times to 10 times.
Okay.
And then here's your handles. They've got buttons on the sides, so you can move them however you wish, whatever feels more comfortable. And then the last thing, when you're using it, light guide. You come to the back, you have this. You rotate to your left for the orange non-composite curing, and then to the right is a green filter. This one's red free, so it will cut through your blood field. So if there's a bleed or something, you click that on, and then it will show the source of the blood, and then you can just deal with it. Less often used in dentistry. Okay?
Yeah.
So when it comes to moving it, I recommend 2 of you. One holds the pole, one holds the head. So one holds the head like this and the other can push the pole and then you can move it round. You've got casters with locks on the bottom, so just lock it when it's in place and lock it to move it. When it's stationary and round the corner where you want to store it, just hold it in on itself. And then you take the blue bag here, just place it over the whole head, up to the arm, and close it, and then that'll just stop dust getting into all the optics when it's not being used. You just tighten it to the right a turn or so, and then it will stop it from dropping.
Oh, okay.
It's just retightens the clutch. It's the same one that's controlled by this one. So if I loosen it, you'll see it's just really floppy.
Okay.
If you tighten it, it'll allow free movement with some resistance.
Okay.
This one for this movement. So essentially it just means you can get the whole arch and that all going. So that's your full articulation. So if anything starts like slipping or sliding, one of these is just not tight enough. This one here is this movement.
Okay.
So you can tighten that and just stop it going.
Yeah.
So there's a bit more resistance. As I explained, this one just stops the up-down movement. So if I do it, move up, down, it'll stay where it wants to stay.
Okay.
You lock it, and it'll just stay where it is.
Okay.
And then these two, this one controls this point, and then this one controls that movement.
Okay.
So when it's being used for the chair, it's quite important. I recommend here as a position. So first of all, when the patient's in the chair and they're lying down, come up the patient, because you don't want to blind them, going over them, and then you want a slight break in the arm. So it just
Oh,
allows...
because as soon as you turn the on button, the light will be on.
Yeah.
Okay.
So often the microscope's on. So if I turn it on, there's your light.
Oh, okay.
If you do that, it'll turn off.
And you just lifted it up.
Yeah, because it's got a tilting switch.
Oh,
So
okay.
if you come up over the patient's eyes, it will turn off just to help. And a lot of people, they phone and go, oh, my light's not working. So first thing we ever say is it down?
Oh, okay. Yeah.
That happens a lot more on wall mounts
Yeah.
than the floor, because obviously it's up and then you'll hear it just hits the switch, turns off. So when it comes in, up the patient, onto the mouth area. So actually I'll say with this, pull these closer. Because you want a good break in the arm.
Yeah.
So then that allows free articulation, and then when the patient needs to come out, just do that. Because I'm imagining when you go into using this, you won't need the X-ray, will you? Because all that sort of particle treatment's already been
Done.
organised, sorted. So it will got the X-ray, but it shouldn't matter for a clinical day like this. So do you see here where it's uneven, so this is moving? So we want to stop that. That's this one. Just tighten it.
Okay.
It stops.